Okay, good. The other side. Okay. So your thumbs and your toes. So I'm gonna move this and just tell me if it's up or down. You can close your eyes now.
Down. Up. 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 Down. Up. Down. Down. Up. Down. Down.
Okay. You can open your eyes now. So what I'm going to do is I'm going to check the vibration. So you will feel this. And then put it like that. Just tell me when it stops. Okay? So, you ready? Close your eyes now, please.
Stop. 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 Stop.
Okay. So, can you name this for me?
Pen.
Can you name this for me?
Hair.
Okay. So, can you repeat this? No ifs, ands, or buts.
No ifs, ands, or buts.
Okay. So, the next would be, can you take this in your right hand, fold it in half, and put it on the floor? Okay, good. So, can you read sharp or down?
Sharp.
Okay, good. So now, can you clench your teeth? Okay. So, open your mouth. Move your jaws from side to side. Okay, so can you raise your eyebrows for me? Okay, so close your mouth. Move your tongue against your cheek, left cheek, right cheek. Okay, done. Okay. Okay, so put your right hand on the fist. Can you push against my hand? Push against my hand. Okay. So push against my hand. Push against my hand. Okay, so extend your fingers. Try to resist. Okay. Other side. So try to squeeze my hand as hard as you can. Okay. Good. So try to push your leg against my hand. Okay, on the other side. Okay, bend your knee. So try to push your hand against your leg against my hand. Okay.
Ask the subject to step forward. Ask them to raise their arms in the air, legs spread out. Let's make sure you are efficient with your pat down from upper and lower body. If the subject is found with no concealed item, subject is clear to enter property. As you check the arms, make sure you check from the shoulder to elbow to wrist. As you check the back from upper and lower, check underneath the arm, sides, and back in front of hip. As you check the lower body, you want to check the center thigh, knee, and ankle. If you happen to find a concealed item during pat down, you are to take the item out, place it away from the subject, and inform your supervisor immediately.
Now we'll switch to the bell for the lower tones. Herb's point, pulmonic, aortic. Excellent. Listen for your carotid arteries. There's no extra sounds there. Nice crisp S1, S2. So I'm not worried about blockage. Okay. And we'll listen over the aorta and the renal arteries. Perfect. Nice and clear.
Okay.
Okay. Stomach is nice and flat with good muscles. I don't see any lumps or bumps, any lesions which are of concern. I'm just going now, Katie, to feel very lightly superficial palpation.
Okay.
Let me know if I touch an area that's tender for you. Okay, now we're going to go a little bit deeper, so I'll use 2 hands. How about a deep breath in? And as you blow out, I'll dive. Good. Very nice. You okay there?
Yep.
Okay, and again, let me know any tenderness. Good. Feel your aorta on that. Good. And as I get down, Katie, I can see your aorta pulsating just a little bit because of your leanness.
Okay.
Is it okay if I feel your femoral pulses?
Yes.
Okay. Nice 2+ here and here. We're going to look at musculoskeletal and neuro together. So I'm going to have you lift your leg as high as you can take it. Okay, now bend your knee and take it further. Push me away with your leg. Good. Pull me towards you with your leg. That's right. Good. Now, if I externally rotate the hip, internally rotate the hip, okay? We'll bend the knee as far as you can. Now try to straighten the knee. Good. And now straighten it all the way and try to bend it. Excellent. Okay, now we're going to abduct the hip and adduct the hip, cross the midline. Super. Now I want you to push your legs apart. Good. And pull them towards me. Oh, good. Okay. Now push me away with your ankles. And now pull me towards you with your feet. Good. And I'm just going to feel some pulses here. Good. Nice posterior tibials. And dorsalis pedis. Okay, I'm just going to take off your socks there. Okay, and we're just going to check for sensation, right and left. Tell me if you feel it equally on both sides. Try lateral, medial, lateral, medial, and then toe 5, 3, and 1.
Okay.
All equal?
Wait.
Okay. Perfect. And go ahead and bend your knee. Actually, while we have you up here, does it bother if I bring your toes towards your nose? Okay, now go ahead and bend your knee. Now push me away with your leg and pull me towards you. Good. Okay, and we'll externally rotate, internally rotate. Flex the knee, try to extend. So you can see we're checking range of motion and strength. Okay, and bend the knee. Good. Okay. All right, with the abduction and adduction. Good. Okay. One last reflex here, or we're going to do reflexes next. Katie, we'll try Babinski. Excellent. And a normal Babinski. Excellent. And no edema noted at all. So we'll check your patellar reflex. Good. Let's try this one more time. There we are. Very nice. And then we'll check your Achilles reflex. Good. And one more time. Relax, Katie. Give me 10 miles an hour. There you go. Let's do this one more time. Good. Okay. All right. Now we'll go to the neck. I'm going to have you take your neck all the way back. Flex fully forward. Ear to shoulder. Opposite side. Good. And then rotation. And the other side. Good. And now I'm going to have you try to shrug your shoulders against me. Good. Now don't let me turn your head this way. Don't let me turn it this way. Good. Okay, and we'll look at the shoulders. Can you do the backstroke for me? Excellent. And then can you come out to the side? Don't let me push you down. Can you touch behind your head? So external rotation. And now we'll do adduction. And we'll do internal rotation of the shoulder. Perfect. Can you bring your arms straight out in front? Flip your palms up. And then I want you to flex your elbows. And now try to straighten them. Okay, and straighten. Good. And now try to flex. Good. Okay, now flex your wrists. Try to straighten. Good. And then extend. And try to come back to midline. Excellent. Can you separate your fingers now? Don't let me push them together. Good. Okay, and then I'm going to have you palms up, and I'll have you make a fist and try to grab my finger and squeeze as hard as you can. Nice grip.
Okay.
Okay. Now we'll have you stand.
Okay.
And let's put your back this way.
Okay.
Actually, let's put it this way. There we go. Now I need you to tuck your head as if you're going to dive, and I want you to bend over to touch the ground. So you're nice and straight there. Excellent. And come on back up. And just looking at you, no scoliosis, nice level shoulders, nice looking back. I don't see any abnormal lesions here, lumps or bumps. Can you bend all the way back towards me, Katie? Good. And how about sideways bending? And the other side? Good. And now what about rotation? Twisting, looking over your shoulder? Very good. And the other way? Good. Now, can you tiptoe walk? Good. And now how about heel walking? Good. And now how about heel to toe? Good. And then, Katie, I'll have you just stand with your feet together, have you close your eyes, and lift your arms up. Hold it for the count of 5, 2, 3, 4, 5. Then touch your nose with that finger. Good. And touch your nose with your 5th finger on the other hand. Perfect. Last, can you just squat down as if you're the catcher on a baseball team?
Okay.
And can you take about 4 steps in that position? Duck walking. Very good, Katie.
Okay.
And that's it.
Right.
Thank you very much.
Looking at the legs, I'm looking for any edema. So I do not note any edema. I'm also feeling for color and temperature changes. So if feet and legs feel nice and warm. I'm going to go ahead and assess the pedal pulses, and we're doing that bilaterally. And that is equal on 2+. We also want to assess the patient's strength and range of motion. So we're looking at the hip and the knees. So I'm going to lift up this leg, and I'm just going to bend up. Okay. I'll lift up the other leg. Perfect. And can you do that with this leg for me as well? And the next leg. Perfect. So then also looking at her feet, I want to take a look at her toenails and at her toes. If the patient has toenail polish on, you can check cap refill just above the nails. So less than 2 seconds. You do want to go ahead and check the bottom of the patient's feet. So at the bottom of the ankles, remember all bony prominences, you're looking for any skin breakdown or wounds. And I do not see any wounds or breakdown. Can you go ahead and lift up with your feet against my hands? Perfect. And push down against my hands? Good job. Okay, so the patient has full strength and range of motion in the lower extremities. So since I touched the patient's feet, I am...
Swing your legs over for me, please. So I'm going to start with your head. I'm just going to be palpating So there doesn't seem to be any lumps or bumps. The hair is not brittle, it's shiny. Move on to the ears. Any tenderness while I do that? Nope. Do you have any trouble hearing? Nope. Okay, so she does have some piercings. There doesn't seem to be any infection going on. I'm just going to palpate the neck. The trachea is midline. The neck's not distended at all. Everything looks good. So now I'm going to move on to your mouth. I'm just going to shine a light in and you just say ah, okay?
Okay.
Okay, so the uvula is mid. Just going to undo some exams, okay? So can you do a shoulder shrug for me? Everything looks good. Bilateral. Any numbness or tingling while I do this? Nope. Can you squeeze my hands? Very good. Capillary refill is less than 3 seconds. And the pulses bilateral and present. Okay, everything looks good. So now I'm
Exam. You can swing over here. We're going to start the head, palpating for any lumps or bumps. Here it's evenly distributed, shiny and not brittle. To the ears. It's not infected, draining, swollen. She does have piercings and they're not infected. Are you hearing well?
Yep.
Okay. And we'll go down to the neck. There's no distension. Shrug into my hands, please. And palpating for tenderness, pain, swelling, numbness, tingling. Do you feel any of that?
no.
Okay. And if you could squeeze my fingers, please. Good, nice and strong. And capillary refill. Less than 3 seconds. Good. Radial pulse, present, strong, equal bilaterally.
Okay.
And we're gonna move down.
Nothing.
All right, good. Okay, so your bone assessment was good. We're gonna move down to the legs. Are you feeling any pain, tiredness, swelling?
Nope.
Tingling, numbness?
Nope.
All right. So no signs of edema. Hair is evenly distributed and color is good. Do you mind if I take off your
No.
socks? Palpating dorsalis pedis. Pulse is equal bilaterally, strong and present. And posterior tibialis. Pulse is equal, strong bilaterally. And if you could push into my hands, please. Good, nice and strong. Press down. Good. And if you could sit up. Here's some.
His energy and put him into an extremely relaxed and comfortable state of being and state of mind. Head massages are not only just in general extremely relaxing, but they're
Acupressure point, large intestine 4. With the palm facing down, the point is between the first and second metacarpal bones on the top of the hand. The way you actually find this is to press together the thumb and the pointer finger, and as you squeeze those together, the highest point of flesh between those two at the joint is large intestine 4. In clinic, I instruct my patients to apply the metal element AccuStick to this point multiple times throughout the day. It contains pure essential oils that activate the point. This point is helpful for pain along the large intestine channel, which runs up through the shoulder and neck. It's used for exterior headaches due to wind, and that would be something like a headache while you're having a cold. It's also used for one-sided headaches. You would actually manipulate the opposite side of where the headache is. So most times this point is used for dispersing.